Cognitive behavioral therapy, or CBT, is a type of talk therapy that has been widely used and researched for many years. It helps people change negative thinking patterns and behaviors that can affect their daily lives. CBT is based on the idea that our thoughts, feelings, and actions are all interconnected and influence each other. When we have unhelpful thoughts, it can lead to difficult emotions and unhealthy behaviors, creating a cycle that can be hard to break. CBT teaches us to identify and challenge these negative thought patterns, replacing them with more positive and realistic ones. By changing our thoughts, we can change how we feel and act, leading to a more fulfilling and balanced life. CBT is a structured therapy, meaning it follows a specific plan tailored to each individual's needs. It is time-limited, so treatment typically lasts for a set number of sessions, often ranging from 5 to 20 weeks. People in CBT learn practical skills they can use even after therapy ends, helping them maintain their progress. Overall, CBT is a powerful tool for improving mental health and well-being. It helps people manage a wide range of issues, from anxiety and depression to relationship problems and low self-esteem, providing them with the tools to lead a better life. At its core, CBT involves understanding the connection between thoughts, emotions, and behaviors, and learning to modify these to improve mental health. Techniques such as mindfulness, journaling, and cognitive restructuring are commonly used in CBT to help individuals gain better control over their mental processes. By setting personal goals and tracking progress, individuals can see tangible improvements in their mental health and overall well-being. CBT therapists use a variety of techniques to help clients make positive changes. These techniques are like tools in a toolbox, each serving a specific purpose. Some common CBT techniques include cognitive restructuring, exposure therapy, behavioral activation, mindfulness and acceptance training, and assertiveness training. Each of these techniques targets different aspects of thoughts, feelings, and behaviors. Therapists often use a combination of techniques tailored to the individual's needs. Additional techniques include relaxation exercises, journaling, and goal setting, which help clients manage stress, track progress, and stay motivated. Deep breathing and coping strategies are also essential, helping clients handle anxiety and challenging situations effectively. Cognitive restructuring is a core technique in CBT, or cognitive behavioral therapy. It focuses on identifying and changing unhelpful thought patterns, also known as cognitive distortions, which can negatively impact our mental health. These are negative thoughts that are often automatic and based on inaccurate beliefs, leading to unnecessary stress and anxiety. For example, someone might have the thought, "I'm a failure because I didn't get the job," which can be very disheartening. This thought is a cognitive distortion called all-or-nothing thinking, where situations are viewed in black and white terms. It categorizes the person as a complete failure based on one negative event, ignoring any positive aspects or efforts. Cognitive restructuring helps individuals challenge these distortions by examining the evidence for and against the thought, promoting a more balanced perspective. They learn to replace negative thoughts with more balanced and realistic ones, which can significantly improve their outlook on life. This process helps reduce negative emotions and improve behaviors, leading to a healthier and more fulfilling life. Additionally, techniques like mindfulness and journaling can support cognitive restructuring by increasing self-awareness and emotional regulation. By consistently practicing these techniques, individuals can develop a more resilient mindset, better equipped to handle life's challenges. Over time, this leads to lasting positive changes in mental health and overall well-being, empowering individuals to live their best lives. Exposure therapy is a powerful technique used to treat anxiety disorders, particularly phobias and panic disorder. It involves gradually confronting feared situations or objects in a safe and controlled environment. The idea behind exposure therapy is that avoidance of feared situations maintains anxiety. By gradually facing their fears, individuals learn that the anxiety will eventually decrease on its own. This process helps them regain control and reduce avoidance behaviors. Exposure therapy is typically done in a step-by-step manner, starting with less anxiety-provoking situations and gradually progressing to more challenging ones. It is important to note that exposure is done at the individual's pace and with the support of a therapist. For example, someone with a fear of heights might start by looking at pictures of tall buildings, then progress to standing on a low balcony, and eventually work up to visiting a high-rise building. Each step is carefully planned and monitored to ensure the individual feels supported and safe throughout the process. With consistent practice and support, exposure therapy can significantly reduce anxiety and improve quality of life. Behavioral activation is a CBT technique that focuses on increasing engagement in positive and rewarding activities. It is often used to treat depression, which is often characterized by withdrawal and inactivity. The core principle of behavioral activation is that action precedes motivation. By engaging in enjoyable activities, individuals can improve their mood, increase their energy levels, and break the cycle of inactivity and depression. Therapists using behavioral activation work with clients to identify activities they used to enjoy, or new activities they want to try. They help clients schedule these activities into their week and overcome any barriers to engagement. Mindfulness and acceptance techniques are increasingly incorporated into CBT. Mindfulness involves paying attention to the present moment without judgment. Acceptance focuses on embracing thoughts and feelings without trying to change or control them. These techniques help individuals develop a different relationship with their thoughts and emotions. Rather than getting caught up in negative thoughts or struggling to suppress unwanted feelings, they learn to observe them without judgment and let them pass. Mindfulness and acceptance can be particularly helpful for managing anxiety and stress. By focusing on the present moment and accepting difficult emotions, individuals can reduce rumination, worry, and emotional reactivity. Assertiveness training is a CBT technique that helps individuals develop effective communication skills and set healthy boundaries. It focuses on expressing one's needs and opinions in a clear, direct, and respectful manner. People who struggle with assertiveness may find it difficult to speak up for themselves, say no to requests, or express their feelings honestly. This can lead to feelings of resentment, anxiety, and low self-esteem. Assertiveness training teaches individuals how to identify their rights, communicate their needs effectively, and handle conflict constructively. It empowers them to build healthier relationships and improve their overall well-being. The power of CBT benefits and beyond. Cognitive behavioral therapy, commonly known as CBT, offers numerous benefits for individuals struggling with a wide range of mental health concerns. It is a structured, goal-oriented form of therapy that focuses on identifying and challenging negative thought patterns. CBT has been found to be highly effective in treating various conditions, including anxiety disorders, depression, post-traumatic stress disorder, obsessive-compulsive disorder, eating disorders, and substance abuse disorders. It helps individuals understand the connection between their thoughts, feelings, and behaviors. The benefits of CBT extend beyond mere symptom reduction. It fosters a deeper understanding of oneself and promotes long-term mental health. CBT equips individuals with valuable coping skills and strategies that they can continue to use long after therapy ends. These skills include mindfulness, journaling, and structured problem-solving techniques. By learning these techniques, CBT empowers individuals to become their own therapists, enabling them to manage challenges and maintain their mental well-being independently. This sense of empowerment can lead to a more resilient and fulfilling life. If you are struggling with mental health concerns, consider exploring CBT as a treatment option. It offers a practical approach to overcoming difficulties and achieving personal growth. Consult with a qualified mental health professional to determine if CBT is right for you. Embark on a journey toward a healthier and more fulfilling life, equipped with the tools and confidence to face any challenge. If you found this video helpful, please subscribe to our channel and hit the notification bell to stay updated with more content on mental health and well-being. Thank you for watching!